Hi guys, we just want to welcome you to our virtual Aveli experience. I'm Alexa Borodiak and this is Kenny Mason. We are Dr. Bucky's PAs here at Bucky Plastic Surgery.
We're so happy to have you guys here, and we encourage that you stay through the end of the presentation so that you are able to attend our live Q&A. Don't forget to submit your questions so me and Alexa are able to answer them during the Q&A portion.
We are so excited to offer you $500 off your Aveli treatment as long as you book within the next 24 hours for consultation. Aveli is a device that we use here at Bucky Plastic Surgery to basically go underneath the skin and break up any of the adhesions or septae that are causing that cellulite depression. This is the only device on the market that is able to permanently get rid of that cellulite depression.
So Aveli is the first of its kind where it's able to go underneath the skin and break up the bands. And with the way that the device is made, we're able to break up the bands in multiple ways so that we make sure we get it from all angles so that these cellulite bands don't come back. Other treatments that have been on the market aren't able to do this. That's the reason that we brought Aveli into our practice. Cellulite is caused by these fibrous bands within the fat layer that pull down on the skin, causing an indentation. The biggest factor to someone having this is mostly hereditary, but there are some factors through life, like what we eat, sort of any hormonal changes, and as we age, cellulite becomes more of an issue, but most of it is caused by our genetic makeup.
We are so excited to have this device here at Bucky Plastic Surgery because it is the very first of its kind to physically break up those adhesions causing that cellulite depression. There are no other devices on the market that can do this.
Aveli is FDA approved to treat the glutes and the posterior and lateral thighs. Any indentations that are on those areas are able to be subcised using the Aveli device, which just means that we're able to go underneath the skin and break up those little bands that sort of run across, causing the indentations that are pulled down.
So an ideal patient to come in for Aveli treatment would be a patient that has some cellulite depressions on their medial, lateral glutes, or posterior thighs.
So we typically tell patients that we don't want them to raise their heart rate for up to 2 weeks. However, usually post-op day 1, patients feel like themselves. Usually the biggest complaint that we hear is bruising on the butt or thigh after doing the Aveli treatment. But we've now brought into our office a CO2 lift mask that is able to help minimize bruising post-op.
Hi, I'm Alexa. So nice to meet you.
Hi, nice to meet you.
So you're here for a cellulite consultation today, correct?
Mm-hmm.
And tell me kind of what brings you in.
I've just kind of had cellulite my whole life and haven't been able to do anything about it, so I was really interested in it.
Yeah. So in general, cellulite is typically hereditary, so a lot of us struggle with it. I personally struggle with cellulite as well. But we're super, super excited about our device here called Aveli to permanently break up the bands that cause the cellulite depressions. Okay, so before we get started, let's just talk a little bit about about the device and some before and afters, and if you have any questions or need anything, you can just let me know. You can stop me at any time. So basically, ends the cellulite line game. Like I said, 90% of women have cellulite. Here are some before and after treatments of cellulite. So basically, Aveli is approved to treat the central buttock area as well as laterally, and then the posterior thighs as well. So all these tiny little depressions. So what happens is we take this device, okay, and we basically create this tiny little hole underneath like your gluteal crease. And we take this device, we create that hole, and we're able to physically break up that cellulite depression permanently by breaking up the band causing that cellulite depression. So it's a really great device. It's typically a one and done treatment. So I'm just creating some markings here. So when we go in for the Aveli, we will be able to effectively treat you. So plunge for me. So we're just gonna take your photos now. So I'm gonna have you stand right here on the foot. Yep. And then I'm going to take your gown from you. Okay, perfect. Thank you very much. And now we're just going to get those before photos. So looking at a bunch of these little depressions, so there's just a couple little certain areas. Saying like this fanning technique on both sides, and then we're going to be able to release those bands, and that's how your cellulite is going to be reduced. Okay?
Yeah.
Perfect. We just want to thank all of you so much for joining us for our Aveli virtual event today. We hope that we were able to better educate you on Aveli.
We look forward to answering all of your questions in our live Q&A.
Hey guys,
Hi,
how's it going?
everyone. Hope everyone's
My name's
doing well.
Kenny. This is Alexa.
Yeah, hope
We're
everyone
going to be
enjoyed the
answering
video.
all of your questions having to do with Aveli. So to get started now, our first question here is, how do I know if I am a good candidate for Aveli? You want to answer this one, Alexa?
Sure. So we talked a little bit about it in the video, but lateral, having cellulite depressions on the medial buttocks area or the lateral area, the posterior thighs as well. Having those dimples or cellulite depressions, you would be a good candidate to have Aveli performed.
And we do recommend that coming in for a consult is the best way for us to tell if you are going to need this, because there is a way we want to be able to tell if you're having skin laxity or if you actually have those little bands that are pulling down your skin, causing this cellulite that you think that you have. So consult is always going to be best for this. And then we could do multiple treatments at once to treat what your issue is.
As a female, also, I kind of mentioned it during the video, I personally have cellulite just a little bit. In my 20s, I do a lot of exercising, I eat really healthy, but unfortunately, it is hereditary. So personally, my one thing that I would tell my future patients and future consultations is make sure you come on in for the consult. Commonly, patients will come in and they think that they have cellulite, but they actually have more pronounced skin laxity. So it's really important to come in for that consultation, have the professionals be able to diagnose you and give you your best treatment.
All right, our next question is, what does the treatment entail? So sort of the day of, once we get past that consult part, a patient will come in, we give them a script for Xanax. The Xanax isn't required to get the procedure done, but we do like everyone to have one to sort of calm their nerves, because you will be awake for the entirety of the procedure. So patients take that, they sort of relax for 45 minutes to an hour, and then we take them into the procedure room and we use what is called tumescent anesthesia, and we sort of numb up underneath the butt and the lateral and posterior thigh. It's me and Alexa in the room at the same time. So we sort of tag team it, and it speeds up our process. So the procedure itself takes anywhere from 30 minutes to an hour. You have minimal pain. Once you're numb, you don't really feel a thing. You might feel a tug here and there as we're using the Aveli to break up the bands that are underneath the skin. But once you're numb, most patients say that they're good to go.
Pretty painless.
And then once the procedure's over, we sort of milk all that fluid that's in underneath your butt and thigh out, get you dressed, we get you in your compression garment, take you back to the recovery room, have you sort of chill for 10 to 15 minutes, make sure that all is well, and then you're on your way.
So that kind of brings us into the next question, which is, what is the downtime? So we tell our patients about a week of downtime overall. However, the first 24 hours after that procedure is kind of where you're going to be just feeling, obviously, the effects of the medication that we prescribe you, and you're going to just be a little bit sore from the procedure. After that 24-hour period, I mean, we rarely have any complaints from our patients. You can take extra strength Tylenol, but no pain medications needed. But for the entirety of the downtime, so like Kenny said, we put you in this compression garment for 2 weeks. So that means no high intensity interval training, no strenuous exercising for an entirety of 2 weeks.
All right. Yeah. The next question, can it be paired with other procedures? So yes, so I think that that's a big thing with this, especially with how we talked, separating skin laxity from the bands. We have treatments here that can treat the laxity, and we also have Aveli, which can treat the bands. And these are all procedures that can be done at once in our office, where you don't have to go to sleep. You're just numbed up. Procedures are all done at once. Aveli is a one-time thing, where some of these other procedures could be multiple sessions, but that would be something obviously that we would go through at your consult. And also we do this procedure in the operating room as well. So if someone is getting any other sort of body surgery, breast surgery, and face surgery, Aveli can be done at the same time, and it really doesn't add any downtime to the downtime you're already going to have from the procedure being done.
Obviously, just like with any aesthetic treatment, combination therapy is always best. So commonly we will pair this with other skin tightening treatments.
Is there skincare that I should be using with procedures?
So immediately post-treatment, we apply this new, it's called CO2 Lift Pro Mask. And if you are a patient here at Bucky Plastic Surgery and you've come in the last 30 days, we've been offering a lot of complimentary CO2 Lift Pro masks. This time we actually apply to the buttocks. And what CO2 Lift Pro is, it is topical carbon dioxide, which brings oxygen-rich blood to the surface of the skin. It helps to expedite healing, and it's really hydrating. Obviously, for post-procedure, the hydrating part is a little bit irrelevant, but the goal is we want to expedite your healing and minimize bruising. So that's something else that we could kind of discuss. We definitely advise all of our patients to beware of bruising for at least 2 to 3 weeks post-treatment. So it's just kind of something to note. But yes, the skincare is something that we do sell here, and we do apply immediately post-treatment to just expedite your healing and make sure you have the best experience possible.
Yep. So can this be used on the front thigh? So right now it is not FDA approved to be used on the front thigh, and I'll speak for us and we have not done any on the front thigh. So as of this point, I would say no.
So then this kind of comes back to our question and the most commonly discussed thing during consultation: skin laxity versus true cellulite. Typically, patients don't have true cellulite on their front thigh, the front of their thighs. It's typically skin laxity. So for these types of concerns, a better targeted treatment would be something like the next thing we're about to talk about, like a radiofrequency microneedling or radiofrequency treatment that has added heat to kind of help tighten up the skin.
So next up is, what is the difference between this and Body Tight that is on your website? So Body Tight is something that we use in combination with liposuction for the most part. So what Body Tight does is it's tightening the ligaments and collagen underneath your skin after the fat is sucked out. Because when fat's sucked out and we don't do anything to the skin, that skin can become lax. So Body Tight's role is more tightening up lax skin, where Aveli is breaking up these bands that are releasing skin that is being pulled down. So cellulite isn't as much of a skin laxity issue as it is these fibrous bands that sort of either tighten up or shrink down over time, where they should all be in line. Now some of them are pulling down, causing those little craters.
Let's do the next. Can you give examples of locations of skin tightening you do in conjunction with this procedure? Yeah, so radiofrequency microneedling would be something we would do in conjunction with Aveli.
Yeah, so Morpheus 8 is what we use here for the most part, and you could do both of those at the same time.
Yeah, and then just to kind of educate patients, radio frequency is added heat, so that's for further tightening, and then microneedling, obviously we're creating a controlled injury to your skin to allow for collagen remodeling, so that's just going to further tighten the skin.
Can cellulite reform? Would I have to repeat this? So no. So if this treatment is done right, studies have shown after 12 months, the bands that have been broken up have not come back. So I would say this is a one and done thing if we do our job.
Having said that, though, if you changed your habits completely and put on a ton of weight, and you started to develop other new cellulite, that would be a different conversation that we would have to have in the future.
All right. If you guys have any more questions and want to send them in, we are happy to answer them.
Also, guys, as a reminder, you're going to be receiving a text message, so please reply with the code Bucky to be contacted for a consultation. So I think that pretty much concludes.
Wraps it up. If anyone has anything else to ask.
Any last speak now or forever hold your peace?
What's that? Oh yeah. So if you do sign up and you do get your treatment done before October 31st, Aveli is offering a $250 MasterCard gift card, which would be on top of the $500 that you receive off here. So it would be about $750 in savings. Our treatment cost is $4,000. So you would be getting it down to $3,500 and then an additional $250 gift card.
So just to kind of reiterate again, if you sign up for a consultation within the next 24 hours, $500 will be deducted from your treatment. So that would bring us to $3,500.
All right, guys, if you don't have any other questions, we thank you for joining us to learn all things Aveli.
Thanks so much, guys. Hope you guys have a great night. Thanks again.